You know, when you hear oral health in care homes, what comes to mind? Probably just brushing teeth, right? Well, it turns out it's so much more than that. We're talking about something that is absolutely critical to a resident's dignity, their nutrition, and their entire quality of life. And today, we're going to unpack exactly why this is such a huge and often unspoken problem. Wow, this quote from a care homeowner just hits the nail on the head, doesn't it? I used to think it was just about brushing teeth, but it's much more complicated. That's the journey we're going on today, from seeing a simple task to realizing it's this incredibly complex web of care. And you'll hear that same idea from everyone, from staff, from inspectors, even from dentists. But to really get it, we have to start on the front line with the carers themselves.
All right, let's dive right in. We're starting with the people who are right there in the thick of it, day in and day out, the carers. Their reality really shines a light on why just having good intentions, well, it's often not nearly enough.
I mean, just listen to this. Mouth care sounds like a small part of personal care, but in practice it can be one of the most difficult things to do well. That right there, that's the core problem, isn't it? It sounds simple, but the reality? It's a whole different story. You're trying to do this during the busiest, most chaotic parts of the day, when a dozen other essential things are all demanding your attention. It takes a ton of skill and, frankly, an almost superhuman amount of patience.
And then you add dementia into the mix. This is where things get so tough. Imagine you're a resident and you don't recognize this object coming at your face. You don't understand what's happening. Of course it feels threatening. So they might clamp their mouth shut or bite the brush. They get distressed. And now, as a carer, you're caught in this awful position. You're trying to provide absolutely essential care, but you're also dealing with someone's genuine fear. It's got to be incredibly frightening and emotionally draining for everyone involved.
And this is exactly why it matters so much. This is the human cost. It's not just about clean teeth. Let's be really clear about that. When this goes wrong, the consequences are huge. We're talking about real pain, serious infections. We're talking about people not being able to eat or drink properly. It can make it hard to communicate, and it chips away at a person's dignity. Suddenly, that small part of personal care has this massive, snowballing effect on someone's entire life.
So you might be thinking this is all down to the individual carer's struggle, but it's not. This is way bigger. It's a systemic problem. And to really grasp that, we need to zoom out and look at the view from people who see the whole system in action, folks like inspectors and visiting dental professionals.
Okay, this quote from an inspector is absolutely crucial. They say they often see action taken after something bad has already happened: pain, weight loss, infection. The whole system is reactive. It's not designed to get ahead of problems, it's designed to respond to crises. Think about that. By the time anyone steps in, a resident has already been suffering. It's pure firefighting, not fire prevention.
And look at this comparison. It just lays it all out crystal clear. On the one hand, you have the goal, this preventive model. Routine checks, early advice, staff who actually feel confident. But on the other hand, you have the reality for so many, this reactive model. Action only happens after pain starts. Staff are uncertain. It's that constant, exhausting cycle of firefighting when the damage is already done.
But wait, it gets even more frustrating. The problem doesn't even stop there. A visiting dental professional points out that, okay, let's say a carer does spot a problem early. Great, right? Well, not really, because the next step, actually getting professional help, is a massive hurdle. This is where you see the bridge to outside dental services is just completely broken. Just put yourself in their shoes. You're a carer, you see something's wrong, but who do you call? Is there a number for routine advice? Is this an emergency? The pathway is a total mess. And while you're trying to figure it out, the resident is just waiting and waiting, and what could have been a totally manageable issue quickly blows up into a full-blown crisis. All that extra pain and distress, it's completely avoidable.
Okay, so we've seen the daily struggle for carers and the massive flaws in the system. Now let's shift gears and step into the manager's office. Because from their perspective, oral health isn't just one little task on a checklist. Oh no, it's connected to, well, pretty much everything.
They call it a constant headache, and that phrase is so telling. For a manager, think about it. A single lost pair of dentures isn't just the lost item. It's the first domino in a long line. That can lead to poor nutrition, which can become a safeguarding concern, which can then get them in hot water with regulators. It's this massive chain reaction. And this table just shows you how deep that web goes. Look at this. It touches on everything. Dignity, a person's confidence can be shattered if they lose their dentures. Nutrition, it's impossible to eat well if your mouth hurts. It even gets into safeguarding territory, because if care is repeatedly missed, that can be seen as neglect. And you better believe inspectors see it as a huge indicator for the quality of care overall. See, it is all connected.
Okay, so we've looked at this problem from every angle, and honestly, it can feel a little bleak. But the big question is, what do we do about it? How do we fix this? And the good news is, there is a path forward. It's not some magic bullet, but it's a shared path, with really clear, practical steps that can make a huge difference.
And these aren't just vague ideas, these are concrete actions. Number 1, create individual care plans. Every resident is different. 2, give carers practical training that actually helps them deal with tough situations, like dementia care. Give them confidence. 3, build a simple, reliable system for dentures. Label them, check them, know where they are. 4, set up a clear, easy-to-follow dental pathway so staff know exactly who to call. And finally, number 5, and this is the big one, make it a visible priority. Talk about it in meetings, in handovers. Make sure management is on top of it every single day.
And really, this quote from a dental professional just wraps it all up perfectly. Residents deserve healthcare that is planned, practical, and preventative, right? Not something that's just an afterthought that only happens when things go horribly wrong. This is about shifting the entire mindset from reactive to proactive. It's about building this into the very fabric of daily care. Because at the end of the day, this is about dignity. It's fundamental healthcare.
So, after all of this, what's the one thing you should walk away with? It's this. We need to make oral health everyone's business. This can't just be the carer's job, or the manager's job, or the dentist's job. If we're really going to solve this unspoken problem, it has to be a team effort. The final question is, what role will you play in making that happen?